Good evening, wherever you are. This is Benji Cross from ConferenceHype. From the July 2026 edition of British Journal of Cancer, this journal review looks at TP53 mutation-biased CD8 plus T-cell exhaustion drives lethal outcome and therapy resistance in urothelial carcinoma. Background: emerging evidence has underscored non-cell autonomous roles of mutant P53 in reshaping the composition and functional state of tumor immune microenvironment. Methods: our study included 297 UC patients from 2 in-house cohorts and 871 UC patients from 4 public datasets to evaluate the impact of P53 status on the clinical implications of CD8 plus T cells. Results: high CD8 plus T cell infiltration correlated with favorable prognosis and improved survival following chemotherapy and PD-1 blockade exclusively in P53 WTUC, while its association with prognosis and therapeutic benefit was abrogated in P53 mutant UC. Discussion: the clinical significance and functional polarization of CD8 plus T cells in UC varied in a context-dependent manner according to P53 status. From the July 2026 edition of British Journal of Cancer, this journal review looks at anthropometric traits, metabolic biomarkers, and pancreatic cancer risk, a causal mediation analysis in UK Biobank. Background: obesity is a risk factor for pancreatic cancer, but mechanisms remain unclear. Methods: we analyzed 462,300 adults in the UK Biobank. Results: over a median follow-up of 10.9 years, 1115 pancreatic cancer cases occurred. Discussion: glucose and HbA1c mediate a large proportion of the obesity pancreatic cancer association, highlighting the important role of glycemic control in obesity-related pancreatic carcinogenesis and targeted interventions in at-risk populations. From the July 2026 edition of British Journal of Cancer, this journal review looks at de novo cancer-related mortality after solid organ transplantation in England, the EPCOT study. Background: cancer is a major cause of mortality after solid organ transplantation. Methods: we conducted a population-based cohort study linking data between the UK Transplant Registry, National Cancer Registry, Civil Registration of Deaths, and hospital episode statistics for all SART recipients in England between 1st June 1992 and 31st December 2015. Results: among 50,762 SART recipients, 22,361 deaths were recorded, of which 3,550 were due to cancer, making it the second leading cause of mortality. Discussion: findings: among 50,762 SART recipients, 22,361 deaths were recorded, of which 3,550 were due to cancer, making it the second leading cause of mortality. From the July 2026 edition of British Journal of Cancer, this is a review covering revisiting retinoic acid in AML therapy, mechanisms of action, and rational combination strategies. All-trans retinoic acid, a bioactive vitamin, a derivative, regulates cellular differentiation by activating retinoic acid receptors. While ATRA has revolutionized acute promyelocytic leukemia treatment, its efficacy in non-APL acute myeloid leukemia remains limited due to intrinsic resistance mechanisms, including aberrant epigenetic states and signaling pathways. This review summarizes recent mechanistic and translational advances in ATRA-based combination therapies that target differentiation. This is a good review on the topic, well worth reading in full in this issue of British Journal of Cancer. That is it for this segment. If there are any medical conferences or events you want covered, tag our team on X.
This is Conference Hype. Stay with us, coverage continues.
From the July 2026 edition of British Journal of Cancer, this journal review looks at altretamine induces ferroptosis in small cell lung cancer by promoting epigenetic silencing and lysosomal degradation of GPX4. Background: small cell lung cancer is a high-grade and aggressive neuroendocrine carcinoma that remains incurable due to the emergence of drug resistance and frequent relapse. Methods: altretamine-triggered cytotoxicity and lipid peroxidation were determined by EDU, ferro-orange probes, etc. Results: altretamine mainly initiates ferroptosis in SCLC cells, accompanied by accumulation of intracellular ROS and lipid peroxidation. Discussion: our findings revealed the first time that altretamine induced ferroptotic cell death by promoting DNMT3A-mediated epigenetic silencing of GPX4 gene and HSC70-mediated lysosomal degradation of GPX4 protein in SCLC cells. From the July 2026 edition of British Journal of Cancer, this journal review looks at efficacy and safety of a novel oral antivasculogenic mimicry agent, CVM-1118, in advanced, well-differentiated neuroendocrine tumors, a phase IA trial. Background: highly vascularized neuroendocrine tumors are attractive targets for foslinanib, which disrupts vasculogenic mimicry and induces apoptosis via tumor necrosis factor receptor-associated protein 1. Methods: patients with grades 1-2, well-differentiated lung, gastrointestinal, or pancreatic NETs, refractory or intolerant to one or more standard therapies, and progressing within 6 months, received CVM-1118 in 28-day cycles. Results: of 43 enrolled participants, 35 were efficacy evaluable. Most had grade 2 pancreatic or gastrointestinal NETs with 2 prior therapies. Discussion: CVM-1118 demonstrates favorable efficacy and safety in advanced NETs. From the July 2026 edition of British Journal of Cancer, this journal review looks at the concept of functional cure in advanced metastatic melanoma, treated with combined nivolumab and ipilimumab, or nivolumab alone. Background: immune checkpoint inhibitors have significantly improved the course of advanced metastatic melanoma, and the concept of ICI's curative potential began to appear. Methods: individual patient data were reconstructed from published Kaplan-Meier curves of the anti-PD-1 arms of the CheckMate 067. Results: the 3 complementary approaches were consistent and confirmed the functional cure assumption. Discussion: we showed that metastatic melanoma patients treated with the combination or nivolumab alone who were alive and had not progressed by the 5-year time point can be considered as functionally cured. From the July 2026 edition of British Journal of Cancer, this journal review looks at oligometastatic neuroendocrine tumors, characteristics, and prognosis. Background of this retrospective analysis was to evaluate characteristics and prognosis of the OMD state in patients with NET G1-G2 of gastroenteropancreatic origin. Methods: the primary objective of this retrospective analysis was to evaluate characteristics and prognosis of the OMD state in patients with NET G1-G2 of gastroenteropancreatic origin. Results: the overall study cohort comprised 190 patients. Discussion: these results suggest that a low absolute number of metastases alone may not be a clear prognostic factor in NET. That is it for this segment. If there are any medical conferences or events you want covered, tag our team on X.
This is ConferenceHype. Stay with us, coverage continues.
ConferenceHype is interactive AI commentary only. It is not reporting, journalism, medical education, clinical guidance, scientific validation, legal advice, or financial advice. ConferenceHype is independent and is not affiliated with conference organizers, presenters, sponsors, or exhibitors. From the July 2026 edition of British Journal of Cancer, this journal review looks at functional and omics-based rationale for the induction of BRCA-ANIS by androgen receptor pathway inhibitors to sensitize prostate cancer to PARP inhibition, regardless of HRR status. Background: two PARP inhibitors, olaparib and talazoparib, have been approved in combination with androgen receptor pathway inhibitors for metastatic castration-resistant prostate cancer in Europe, regardless of homologous recombination repair status. Methods: we assessed PARP inhibitors alone and with ARPIs in prostate cancer cell lines, metastatic patient-derived organoids, and LN metastatic tissue slice cultures. Results: PARP-ARP combinations significantly reduced survival in LN-CARP, DU145, and 22RV1 cells, and produced greater cytotoxicity than either agent alone in all models. Discussion: ARPIs induce a BRCA-ANIS-like phenotype through RAD51 downregulation and enhance PARP sensitivity in metastatic prostate cancer models, supporting combined ARPI-PARP therapy. From the July 2026 edition of British Journal of Cancer, this journal review looks at proteomic characterization of SMARCA-deficient esophageal adenocarcinoma reveals complement evasion and DNA repair-associated prognostic subgroups. Background: esophageal adenocarcinoma is an aggressive malignancy in which the SWI-SNF catalytic subunits SMARCA2 and SMARCA4 are frequently lost, yet the biological and clinical impact of these deficiencies remains unclear. Methods: we analyzed 113 EAC specimens using mass spectrometry-based proteomics, including 89 SMARCA-deficient and 24 SMARCA-proficient tumors. Results: SMARCA-deficient tumors showed frequent expression of complement inactivating proteins CD55 and CD59 with distinctive apical and membranous localization. Discussion: from the July 2026 edition of British Journal of Cancer, this journal review looks at olaparib in HR-deficient, metastatic triple-negative breast and platinum-sensitive, relapsed ovarian cancers without germline mutations in BRCA1/2. Phase 2 EMBRACE trial. Background: homologous recombination deficiency from germline BRCA1/2 mutations sensitizes high-grade serous ovarian cancer and triple-negative breast cancer to PARP inhibitors, as may promoter methylation of BRCA1 or RAD51C or mutation of non-BRCA HR genes. Methods: single-arm phase 2 trial of olaparib 300 mg orally twice daily. Results: total 22 enrolled, promoter methylation detected in 815 HGSOC and 57 TNBC, and pathogenic variants in non-BRCA HR genes. Discussion: olaparib demonstrated activity in HGSOC beyond GBRCAM, including with ME-BRCA1 from the July 2026 edition of British Journal of Cancer. This is a review covering Pediatric Therapeutic Development Workshop on medulloblastoma. The second Pediatric Therapeutic Development Workshop focused on medulloblastoma. Between 60–70% of patients with medulloblastoma survive, but survivors have significant long-term side effects, and the highest risk groups have a probability of survival 10%. Thus, the unmet need is to develop therapeutics targeting specific vulnerabilities in medulloblastoma, including poor prognosis disease groups, SHH medulloblastoma, MYCN amplified or TP53 mutated, and Group 3 medulloblastoma, CMYC amplified. And this is a good review on the topic, well worth reading in full in this issue of British Journal of Cancer. That is it for this segment. If there are any medical conferences or events you want covered, tag our team on X.
This is Conference Hype. Stay with us, coverage continues.
From the June 2026 edition of British Journal of Cancer, this journal review looks at circulating metabolite biomarkers associated with prostate cancer risk in Black Americans, findings from the Southern Community Cohort Study. Background: despite the importance of metabolic reprogramming in prostate cancer initiation and progression, little is known about metabolic features associated with prostate cancer risk among Black Americans. Methods: this nested case control study included 195 incident prostate cancer cases and 379 match controls, focusing on Black Americans from the Southern Community Cohort Study. Results: a total of 26 metabolites were associated with incident prostate cancer at p0.01. Discussion: we found several circulating metabolites as potential biomarkers for prostate cancer risk among Black Americans. From the June 2026 edition of British Journal of Cancer, this journal review looks at differences in overall survival for invasive epithelial ovarian cancer by race and ethnicity. Results from the Ovarian Cancer Association Consortium. Background: prior studies have examined survival in patients with epithelial ovarian cancer. However, few consider race and ethnicity, particularly disaggregating Asian and Native Hawaiian Pacific Islander women. Methods: we analyzed data from 18 Ovarian Cancer Association Consortium studies, including women with EOC from Asian, non-Hispanic Black, Hispanic, Native Hawaiian Pacific Islander, and non-Hispanic white racial and ethnic groups. Results: compared to non-Hispanic white women with EOC, Native Hawaiian Pacific Islander, and non-Hispanic Black women had poorer overall survival. Hazard ratios: HR equals 1.58, 95% CI equals 1.16 to 16, and HR equals 1.31, 95% CI equals 1.12 and 54, respectively. Discussion: Native Hawaiian Pacific Islander and non-Hispanic Black women with EOC had poorer survival, highlighting the need to address disparities in outcome. From the June 2026 edition of British Journal of Cancer, this is a review covering can national lung cancer screening programs be implemented without exacerbating social disparities. Randomized trials established that low-dose CT screening reduces lung cancer mortality over a decade ago. However, population programs remain limited, even in high-income countries. Lung cancer disproportionately affects socioeconomically disadvantaged populations. This is a good review on the topic, well worth reading in full in this issue of British Journal of Cancer. From the June 2026 edition of British Journal of Cancer, this journal review looks at Planetary Health Diet Index and breast cancer risk. Background: in 2019, the Eat Lancet Commission defined a planetary health diet, a combination of food groups and ranges of food intakes that would simultaneously optimize human health and environmental sustainability. Methods: we followed 68,254 participants in the Nurses' Health Study and 93,283 in the Nurses' Health Study 2. Results: during 4,182,897 person-years of follow-up, we documented 10,378 invasive breast cancer cases. Discussion: adhering to a diet that supports both human and planetary health was associated with lower breast cancer risk, particularly ER-negative tumors. That is it for this segment. If there are any medical conferences or events you want covered, tag our team on X. This is Conference Hype. Stay with us, coverage continues. Conference Hype is interactive AI commentary only. It is not reporting, journalism, medical education, clinical guidance, scientific validation, legal advice, or financial advice. Conference Hype is independent and is not affiliated with conference organizers, presenters, sponsors, or exhibitors. That wraps up this segment of Conference Hype's coverage. We'll be back with more source-attributed updates soon. Stay with us.